6 million Americans are impacted by atrial fibrillation, better known as AFib. But most people don't know that they're sick until they're diagnosed. The symptoms are frightening, but the good news is that AFib can be treated and managed so people can lead full lives. Joining us to help us understand AFib is Dr. Jorge Sacito. He is the Division Chief of Cardiology at the Medical College of Wisconsin and Director of the Heart and Vascular Services Program for Froedtert and the Medical College of Wisconsin. Thank you so much for being with us to share this information about AFib.
Thank you for having me here today.
Exactly what is AFib?
AFib is the quivering of the upper chambers of the heart. Usually in every heartbeat, we have the upper chambers of the heart squeezing, and then the lower chambers of the heart that do the most work, squeezing all the blood to the rest of the body. Now, of course, if the lower chambers of the heart, the buccal ventricles, were to quiver, that would mean basically cardiac arrest. But the upper chambers of the heart, the atria, can quiver, and still patients can be very, very functional. So it's the quivering of the upper chambers of the heart, and that is usually associated with very irregular heart rates, heart rhythm, and often with also very fast heart rates.
What are some of the symptoms of AFib? How might we know that we're experiencing this?
Well, one thing that is important, some people may feel the symptoms of atrial fibrillation, but others may actually not. So it can be completely asymptomatic, and the first symptom or sign of atrial fibrillation, as we may be able to talk more about, could be a stroke. But what happens in many patients will be feeling the heart really beating really fast. Sometimes they can feel that the heart is beating irregular. Now, when the heart beats fast and irregular, patients may have shortness of breath. Sometimes they may feel dizzy. They could even have loss of consciousness. But again, I would say that the majority of people will feel rapid heart rates, irregular, accompanied by shortness of breath.
You mentioned stroke as one of the things that can happen. What are some of the other medical conditions that can happen if you have AFib and it's not treated?
Well, what happens is that, first of all, one thing that I would like to make a point as well, that to a certain extent, we can prevent atrial fibrillation. The healthier of a lifestyle that we'll live, the less likely that we will have atrial fibrillation. So if we have hypertension, if we have diabetes, if we smoke, if we drink alcohol, those are situations that can absolutely increase the risk of atrial fibrillation. Another important one actually is obesity. So when we see patients with atrial fibrillation, of course, we treat the event of atrial fibrillation, but it is critical that we work on these matters as well to prevent more of these episodes from occurring. So again, managing hypertension well, obesity, diabetes, not smoking, and alcoholic drinks. Another one that we also see an association is sleep apnea, meaning problems with sleep that are associated with the development of atrial fibrillation.
One of the things that does happen, though, is that some people, as you mentioned, don't have any symptoms at all until they have a major medical condition. Is that why a healthy lifestyle is so important to avoiding AFib to begin with?
That is exactly right. That is our recommendation as cardiologists, as healthcare providers, to live the healthiest possible lifestyle precisely to prevent situations like that of atrial fibrillation, because the scary part with atrial fibrillation is that if we are not feeling anything, as I pointed out, some patients may not be feeling anything, the first manifestation could be a stroke. And how is it that this happens? Well, remember that I mentioned that the upper chambers of the heart quiver. Well, when the upper chambers of the heart quiver, there are certain crevices, we call appendages in the atria, in the upper chambers, where the blood can be pulled and then clots can build up in these appendages. And then these clots can then release into the lower chambers of the heart, then to the rest of the body, and that will go, these clots will go to the brain, to the head, and cause strokes. So it is that mechanism that causes the stroke. So if we know that someone has atrial fibrillation, we determine the risk of that patient to have the strokes. And then our recommendation is to give blood thinners because there is a 5-fold increased risk of having a stroke if somebody has atrial fibrillation. And how do we decrease that risk? By giving patients blood thinners. There are other things that we can do, but definitely blood thinners work.
What are some of the other treatments that can be recommended for, can be implemented for people who have AFib?
That's right. So as I pointed out, if we take care of our lifestyle, the chances of having more episodes of atrial fibrillation will be less. The atrial fibrillation can be something very chronic, meaning people can have atrial fibrillation 24 hours, 7 days a week throughout the year, so a permanent, constant condition. But very often what happens is that these are short-lived episodes. Somebody can have an atrial fibrillation episode that may last 5 minutes, 1 hour, 5 hours, 1 day. And then depending on how rapid the heart rate is, we may need to bring the heart rate to a lower rates by either giving medications and sometimes cardioverting the heart, meaning giving a little shock to the heart so the heart gets back to its normal rhythm. So there are two important things here to consider with atrial fibrillation. One, the very high risk of stroke, and for that we give blood thinners. Now, there are other therapies that can be used for someone that cannot take blood thinners because of bleeding risk. We can put an device that excludes, remember I mentioned this appendage, this crevice in the left atrium. So there are devices that we can put there to obliterate, to close that little cave to prevent clots from building up there. So these are very cool procedures indeed. But that is to reduce the risk of stroke. The second risk that we have with atrial fibrillation is that if the heart is beating way too fast, the muscle of the heart can weaken and patients can develop heart failure. So we cannot leave patients on atrial fibrillation if their heart rate is, let's say, greater than 110 beats per minute for a long period of time because the heart may weaken. So it is imperative that we bring the heart rates to lower rates to prevent the heart from weakening as well.
Doctor, thank you so much for being with us. This is such important information for us to have to protect our heart and to protect our health. Thank you for being with us.
Thank you.
And if you want more information on AFib, you can check out the American Heart Association's website at heart.org/AFib. And now we're going to reconnect you to a health story from a few weeks ago about a new American Heart Association program to increase access to blood pressure monitors and high blood pressure information at the 5 Milwaukee County Senior Centers. Now, the American Heart Association and the American College of Cardiology have new guidelines to prevent major health issues by maintaining healthy blood pressure. The recommendations include early intervention, including medication, lifestyle changes such as reducing sodium, regular exercise, and maintaining a healthy weight. The new recommendations also include close monitoring of blood pressure during pregnancy and a finding that maintaining a healthy blood pressure also supports brain health and cognition. More details are available at the American Heart Association website. We're right back.